Australia, our health services provide care for everyone. Although not everyone uses the services, it is essential that we are able to analyze the people accessing healthcare so that we can specifically plan for these groups and improve their care and have better health outcomes. Post-operatively, pain is a huge consideration as most patients, if not all, will experience some degree of pain. The most affected cohort accessing hospital care are people older than 65. Naturally, due to lifespan and health issues which come with getting older, the 65 and older demographic have more health needs than other population groups. Statistically, the male demographic is more commonly admitted for emergency hospitalizations, while females are commonly more admitted as elective patients and during pregnancy admit for cesarean sections. The indigenous population are 2.6 times more likely to be admitted to hospitals than other Australians. Having the ability to collect this data, healthcare services should orientate their services to cater for these demographics. As nurses, we must be able to assess a patient's pain. Pain scales are the best standard practice for doing so and come in many forms which differ depending on the patient. The numerical rating scale is a simple and effective pain rating tool for patients. Patients will choose a number between 0 and 10, 0 being no pain and 10 being unimaginable pain, and it is recommended for use in alert and non-pediatric patients. The neuropathic pain scale is used for patients with nerve pain. It has 8 descriptors of pain, which are set between 0 and 10. Sharp, hot, dull, cold, skin sensitivity, itching, depth, and surface pain. The Wong-Baker scale is a visual scale of faces depicting pain. The scale is recommended for use in pediatric patients as they can more easily relate to faces than a numerical scale, which provides more of an accurate representation of their pain level. The PQRST scale is a holistic approach at rating and determining the source of pain rather than just how severe the pain may be at the time, which scales such as the Wong-Baker and the numerical rating scale provide. The World Health Organization Pain Relief Ladder was originally designed for treatment of pain in cancer patients, but in recent times has become adopted as a scale for pain treatment in other fields, such as post-operatively. The ladder begins with mild analgesia, and as the patient climbs the ladder, stronger relief is given. The current strategies of post-operative pain management follows guidelines set by New South Wales Health under the advisory boards of specialised health consultation companies such as the Agency for Clinical Innovation, Australian Commission on Safety and Quality in Healthcare, and the National Pain Strategy of Australia. The guidelines by the Agency for Clinical Innovation are designed to aid in further developing perioperative structures, processes, and outcomes for patients having surgery and anesthesia. The plan is achieved by sharing knowledge between key members of the multidisciplinary perioperative team for patient-centered care. The perioperative toolkit provided by the strategies and guidelines uses clinical reasoning and evidence to direct resources to clinical need and risk stratification, as well as consider a patient's underlying medical status, social environment, and alongside the impact of the intended surgery. The guideline also shares decision-making with patients and families, as well as integrates primary care. The New South Wales Medication Handling Policy Directive focuses on the best practice principles on medication procurement, storage, prescribing, supplying, dispensing, and administration at New South Wales public health facilities. This includes the guidelines of scheduled medications and patient-controlled analgesia, which promotes the quality use of medications and reduces the medication errors that contribute to poorly controlled post-operative pain. The National Pain Strategy also encourages evidence-based practice. This is achieved through structured goals which support patient education, education of professionals, access to interdisciplinary care at all levels, and quality care and research. Challenges with post-operative pain are various. Challenges which post-operative patients face in smaller, regional and under-resourced hospitals are a failure to adopt an acute pain services team, which has been associated with improved patient satisfaction and fewer adverse events. Acute pain service team members can provide education to patients, training to professionals, and assurance that guidelines and evidence-based pain control are implemented. Another challenge is poor pain management, which persists due to the lack of adequate knowledge and skills of practicing clinicians. Lack of knowledge and training of pain management commonly results on a focused biomedical approach to pain management, disregarding other therapies. Poor pain management can result in patients not receiving adequate pain relief, leading to psychological impacts and delayed healing. Tellier et al. Found that further education and training of medical staff have 5 major themes to improving pain management. Assessment of the physical and psychological aspects of pain, the clinical management of pain including pharmacology and alternative therapies, communication and the development of a good therapeutic relationship, ethical considerations that emerge in pain management, and the institutional settings where pain education takes place. Accessing education and training can now also be done online for healthcare workers, for example, modules on HETI. Patient education of pain management postoperatively is a vital component of pain control. Patient education results in patients ruminating less, needing less pain relief, increased pain tolerance, and increased physical performance. The final recommendation is that clinicians adjust the pain management plan based on adequacy of pain relief and presence of adverse events. Patients who undergo surgical procedures experience acute or postoperative pain, with evidence suggesting less than half report adequate postoperative pain relief. Universally, it is accepted that patients after surgery should be allowed to recover through a relatively painless process, and as pain is a subjective experience, pain relief be given as needed.